This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program, Dave Wilson, and a very good morning to the lovely and talented Sarah Giossi. Good morning, Sarah.
Good morning, Dave. How are you?
I am ready to get this week rolling, so let's do it. Ready?
All right, let's do it.
All right.
Why don't we start by introducing our special in-studio guest. Today we have Dr. Gabriele, radiologist at Mon Health Medical Center. Good morning, Dr. Gabriele.
Good morning, Sarah. Thank you for having me.
Absolutely. Did you have a good weekend?
I sure did.
Good.
Sure did.
Despite all the snow that came last night, we're
it was a
hanging
little
in.
slippery getting here, that's for sure.
I was worried about you guys, but, not too bad. Everybody made it. And today we're obviously going to be talking about the radiology program. But before we get there, why don't you first just tell our listeners a little bit about you?
Well, I've lived in Morgantown most of my life. Graduated Morgantown High in 1981 and went on to WVU and undergraduate. WVU Medical School and did some radiology residency training here at West Virginia University Hospitals and then some additional training in Pittsburgh. Since then, I've been working at my hometown hospital at Mon General Hospital, now Mon Health Medical Center, for the last 25 years.
Oh, I won't hold the MHS thing against you.
Oh, well,
I'm a hawk. But that's all right. But see, Dave and I, we have this battle because he's the voice of the Mohegans
That's
for
correct.
all of the
Wasn't
sporting.
that a great basketball
Was
game
a
last night?
fantastic Friday night, was it not?
It
Awesome
was.
game. Last second buzzer beater.
Oh, gosh.
Perfect.
That's why you're all riled up for this week
A
because we've
bank
got more
three.
games.
What
Bank
about that?
3.
Yeah.
That's right.
So how cool is it to get to work at your hometown hospital?
I think it's really a privilege, really.
Yeah.
You get to take care of the community with which, supported you probably through your educational process, and now you're sort of returning the favor. So, and I'm happy to do it.
And what about radiology sparked your interest?
For me, I had other family members involved in radiology, but what interests me most about radiology is really there's almost an X-ray of some sort that is involved in every specialty of medicine, and except for maybe dermatology. So,
But yeah, that's cool because then you get to kind of have your hand in on all of the various disciplines
absolutely,
and
yes.
play a role. That's pretty amazing.
Now, Sarah, this might come as a shock to you that during my career, I've seen a few radiologists.
I'm
That's shocking,
totally
right?
shocked. Yeah.
Few x-rays, a couple of different scans.
Everyone's
Yeah.
broken a bone.
Yeah.
sometime.
Right.
I had a mug at the it was called Quick Care one summer. I was there so often getting x-rays. So, Dr. Gabriele, in general, when we're talking radiology, obviously that's x-rays, but it's so much more than just going and getting a bone x-rayed, right?
Absolutely. Of course, there's plain X-rays, bone X-rays, elbows, chest X-rays, and so on. There's also fluoroscopy studies, which is when you get an upper GI and have to drink barium. And then
Oh,
everyone's
I've heard about that stuff.
not tasty, but sometimes necessary. Then, of course, there's CAT scans. Everyone's heard of CAT scans, ultrasounds, MRIs, and one of the important things that we do for women is the screening and diagnostic mammograms. And then in the evaluation of cancer, PET scans is another important service that we provide, as well as interventional radiology procedures.
How have these procedures, are they more accurate than they were, let's say, 10 years ago, 20 years ago, when I was getting collarbones and ankles and hands x-rayed? Are we more accurate than throwing the old film up on the screen?
Well, the essential anatomy and the essential techniques are the same, but we do the x-rays with less radiation now than ever before, with the digital technology, which we didn't do before. And so there's increased patient safety, hopefully some improved accuracy, and we can save the information in case you need to come back to the hospital more easily and compare those films.
It is amazing, and I feel a bit like a broken record each Monday. We just talk about all of these advances in medicine whenever it comes to technology. And to Dave's point here, I feel like this has to be one of those areas where that's got to be true. And it's really interesting because, again, you can have a very quick, easy in and out experience coming to visit you, right?
Absolutely, yes. Mm-hmm.
So we can get them in and out the door. It's just amazing compared to, 40 years ago. We wouldn't have been able to even see things.
Hey, anytime I was getting x-rays, I was never in and out
In
the
and
door.
out.
But there were other reasons for that.
Sure.
Usually. We're talking to Dr. Fredrick Gabriele, radiologist at Mon Health Medical Center. We're going to continue to discuss what services are available at Mon Health. A little bit later on, get into some of the myths, Sarah, because people like to make up
Yes.
stories about, they stick you in the CAT scan machine. You may never come back out.
Right.
I don't know if that's true. We'll get into that as well as we continue this edition of Mon Health Talk right here on WAJR. Dr. Fredrick Gabriele is our guest this morning in studio, radiologist at Mon Health Medical Center. And Dr. Gabriele, when I think radiology, and I've referenced the several broken bones that I've had, I that's what I think. I think broken bones, x-rays, but why might a patient be referenced to you to head to the radiology department? What other diagnostics are you doing there?
Well, one of the more common ones we do at Mon General is MRI imaging of joints, because there's so much orthopedic surgery done at Mon General. That's an important test that we do there. And there's lots of cancer care that we do at Mon General Hospital. And so that means PET scans, MRIs, CAT scans are done quite frequently in the diagnosis and follow-up of all of those patients.
Now, you're not a one-man team, right?
That's right, Sarah.
So talk to me a little bit. It's not just Mon Health Medical Center, but it's actually all 3 hospitals and a large team of radiologists?
That's exactly right. There's 20 board-certified radiologists, all very capable, and we serve all 3 hospitals, the Mon Health Medical Center in Morgantown, Preston Memorial in Kingwood, and Stonewall Jackson Memorial Hospital in Weston. So we have enough staff to give a 24/7 coverage at all these locations. And with that in mind, we've been able to achieve what something that our practice is pretty proud of, and that is a 98% 15-minute turnaround time for emergency room x-rays.
Wow.
That means once you get to an emergency room, whether you're in Kingwood, Weston, or Morgantown, and you have an x-ray, a CAT scan, or something like that, the result is back to your doctor within 15 minutes.
Oh, wow. That's amazing to me, because you come in with a broken bone or something, anything. You come in with anything, and being able to that quickly start to get those diagnoses so that you can be moving forward with treatment is huge.
It's important, and it's what the patients want.
Yeah, because you don't want to sit there for 2 hours with a broken leg. Come on now.
Or collarbone.
Or anything. Whole face.
Sounds
with
like
your
the voice
baseball
of experience, Dave.
Yeah.
Yeah, there were some experiences, that's for sure.
And can you get the mammogram services at all 3 hospitals as well?
Absolutely. In fact, we offer the new 3D mammography at Mon Health Medical Center as well, and it's a wonderful service. We provide needle localization procedures at all 3 hospitals, and biopsies are frequently done at Mon Health Medical Center.
Sarah, one of the things we have talked about and mentioned several times over the course of the show is how many procedures are non-invasive these days, right? They can get in. And we were talking about heart surgeries that are non-invasive, and they kick you out the next day.
Yeah, it's
I say
wild.
facetiously.
Yeah.
When it comes to non-invasive radiology, it's about as easy as it comes. It's not. It looks scary. Some of that equipment can be big. I get that. Again, I've been there, but it's not scary, is it?
Well, we've come a long way. We used to have to put needles in people to look at the arteries and the veins, and now we can just put you through the CAT scanner and do a CT angiogram, and it's so much easier on the patient. Of course, you go through that donut, and some people don't like being in the donut, but it's a lot easier than having X-ray dye through catheters into your arteries and veins. So yes, you're right. We've come a long way.
Now, let's switch gears for just a minute, Dave, and talk about the myths for a minute. In particular, when we hear radiology and we hear radiation, that's a word that can sound really scary. Like radiation could really do some damage to us. Talk to me more about that. Is there truth to that?
Well, everyone is certainly worried about it, but it's the low radiation that we use to do, say, a chest X-ray is minimal. And most of the X-rays pass through the patient onto the film or onto the digital screen to create the image. And so we're using the least amount of X-ray possible to create the best diagnostic possible image. I'll give you an example. The amount of radiation that's left over in a patient is what we call effective dose. 0.1 millisieverts is really what a chest X-ray is, and the average background radiation that West Virginia provides just by walking around the state of West Virginia is 3 to 4 millisieverts. So the amount of X-rays for, say, a chest X-ray, the exposure is minimal. Now, for other tests, it's a little bit more, 10 to 12 millisieverts, if you will, for a CAT scan, 2 for a collarbone or a spine X-ray. So it can be more, but you need thousands of millisieverts before you have any significant injury, and we never approach that number. I've been working for 29 years total in radiology and have not seen a radiation-induced injury.
Yeah, I think I got more than that just out there microwaving my coffee this morning.
I guarantee you did with that microwave.
That microwave.
One of the other myths, commonly heard myths, is I could get sick from the X-rays, from the radiation from these scans. It would take an extraordinary line of events, wouldn't it, to reach the point where you get sick? That seems like it's an out there consequence.
Yeah. Most X-rays are, again, 1 to 10 millisieverts or so on, and you need, like I said, thousands before we even worry about the risk for any radiation burns on the skin or anything of that nature. So it's not an issue in diagnostic radiology.
See, nothing to worry about.
Exactly.
Nothing to worry about. Hey, coming up, we're going to get into Mon Health's ultrasound, the CT, MRI, those other services. How do we know that you know what you're talking about? Trust me, we'll get to that coming up on the other side of the break. Dr. Fredrick Gabriele, radiologist at Mon Health Medical Center, is joining us in studio this morning on Mon Health Talk on WAJR. Dr. Fredrick Gabriele, radiologist at Mon Health Medical Center, is our guest this morning in studio. And I kind of jokingly said, how do we know that you know what you're talking about when it comes to our CT scans or X-rays, MRIs, and all the above?
Well, there's a way that the American College of Radiology, sort of the oversight committee in the nation for imaging, has accredited certain services at hospitals, including CAT scans, mammograms, ultrasounds, and once they give you their accreditation, it's like getting the Good Housekeeping seal of approval on how you do your procedures, and what they look for is, are you doing the best image quality with the least amount of patient risk and the best patient outcomes. And we have that approval and accreditation for all those areas at Mon Health Medical Center.
That's wonderful. And you know, as we're talking about radiology, again, this is something where I think a lot of people have had experiences where they've had to have an X-ray or something. So what are some of the most frequently asked questions that you get? And I know we've hit some of the myths, but I bet you hear some funny ones too.
Why does the MRI make so much noise?
Yeah.
Everyone asks that question, and there is a scientific answer. Of course, MRI isn't really ionizing radiation. It's electromagnetic radiation. And so we have large magnets, and the smaller magnets have current that goes through them, and when it changes direction, it makes a banging sound. We just received a new MRI at Mon General this past summer, and I just discovered that you don't even have to listen to the banging anymore. It's minimized completely, and you can choose your Pandora station of choice to listen to while you're in the scanner.
How about that?
So it's even that has been minimized, the sound problem.
Can you listen to the Mon Health Talk Show while you're...
That should be an option.
Right.
It should be an option, yes.
We'll have to customize that one.
That's why you got to take, all the change out of your pocket? No metal when you go in the MRI, if I remember correctly.
Yes, well, that's an important question, too. Why is metal such a big issue with MRIs? And, of course, it's the electromagnetic phenomenon. What we do today, of course, is screen the patients, make sure there is no metal in them, and the newer prostheses, implants in the ears and the joints and so on, we're making a lot of medical progress to make all that MRI compatible. So in the future, that'll become less and less of a problem.
Wonderful.
All right, let me throw this one at you then. What's one of the most interesting kind of off-the-wall questions? Is there any that jump to the forefront?
People talk about genetic imaging or, metabolic imaging. We're sort of there to some degree with PET scans and other things, but the things that I read in the journals, I think we have some explosive changes in medicine coming in the next few years that I'm not even sure I can fully contemplate just yet. But
or want necessarily. We'll see. Yeah.
My son's in medical microbiology at WVU now, and he's telling me things that sound fascinating, and I can imagine their medical applications will be wonderful. So.
All right.
Talking to Dr. Fredrick Gabriele. Got a couple of minutes left here in the program. Anything else we want to make sure we touch on here?
Well, I just wanted to ask about interventional radiology. Yeah. Can you talk to us just a little bit about that in about a minute?
Sure. Interventional radiology is using image guidance, whether it's a CAT scan or an ultrasound, to place a needle or a tube. And we're doing these to do biopsies. And the reason this is so valuable is it saves the patient from having surgery to do the same biopsy or the same drainage procedure. So it usually reduces patient risks, shortens the patient's hospital stay, and so on, and that's a good thing.
Don't get me wrong, it's a beautiful hospital, but shortening the stay, that I think most people want that. You want to be able to go home and be in the comfort of your home.
Home-cooked meals.
Exactly. Not that the Jell-O's not great. I'm just kidding. Actually, the food is great at Mount General Hospital, but, it's nice to be able to get back out of there, too.
And generally speaking, if folks come to see you, they will have seen their probably primary care physician first. They're going to be referenced to you at this point.
Absolutely. There's always a request for an X-ray to come through first from their primary care doctor before they see me. Yeah.
All right. Seems pretty,
straightforward.
I feel like things are just getting easier and easier.
By the way, if you ever run into a radiologist at a party, stick around them. They've got some of the best stories. I'm just telling you from a radiology tech that I know, they got the best stories. We'll just leave it there.
So there you go. You're getting invited to our next party.
We're out of time,
yeah.
Dr. Gabriele.
Thank you, David. Thank you, Sarah.
Yes.
Website,
yeah,
Facebook
it's just
page?
monhealth.com. Yes. Okay, good.
Easy,
I got
squeezy, lemon
confirmation
peasy.
on that.
Yes. All right. You can also check out the video podcast of this show over at that website as well. Dr. Fredrick Gabriele, thanks for stopping by this morning. We appreciate it.
Thank you, David.